Dear colleagues, this is the MRI brain examination of a middle-aged patient who presented with right orbital swelling. This is the DWI sequence. Here we can see that the right optic nerve is hyperintense in signal intensity. This is the ADC sequence. Here we can see it appears low signal intensity on this sequence. It appears hyperintense on T2 fat set images, and there is also stranding of the retro-orbital fat. Another finding we can see there is opacification of the right-sided ethmoid cells. This is the coronal section. Here we can see. On post-contrast images, the retro-orbital fat appears dirty. Also we can see there is opacification of the right frontal sinus as well as of the ethmoid cells. So this is the typical case of ischemic optic neuropathy secondary to orbital cellulitis. Ischemic optic neuropathy is one of the most prevalent disease in the middle-aged and elderly population. It is an acute ischemic condition caused by interruption of the blood flow in the ophthalmic artery or its branches, resulting in varying degree of blindness. Ischemic optic neuropathy is classified into anterior and posterior according to the affected part of the optic nerve. Anterior ischemic optic neuropathy is manifested by pale edema of the optic disc and peripapillary hemorrhage. Posterior ischemic optic neuropathy is retrobulbar in location, involving the optic nerve or optic chiasm, but the optic disc is not initially swollen. MRI is the modality of choice for diagnosis of ischemic optic neuropathy, and DWI plays a central role in the assessment of the acute ischemic insults. Because the optic nerve is an extension of the CNS, as is the spinal cord, the pathophysiology of acute optic nerve ischemia is expected to be similar to that seen in the brain and the spinal cord, with cell swelling and restriction of water diffusion leading to the reduction in signal intensity on the ADC, as we have seen in the case. There are many causes of ischemic optic neuropathy. Orbital cellulitis is one of the cause of ischemic optic neuropathy. MRI is the only imaging modality of choice in the evaluation of orbital cellulitis because of its superior soft tissue contrast resolution. It is vital to evaluate the extent of the orbital infection, underlying paranasal sinus involvement, as well as to detect complications of the orbital cellulitis, especially intracranial spread. Thank you.